You are going to be hard-pressed to find a program like ours anywhere in the country, much less in the Southeast. You're not going to find faculty members who are as committed and want you to learn and want you to see things as we have here. Being an unopposed program in a very, very large medical community is a great opportunity. And I would say our residents come out so well prepared for any career they could want.
As cliche as it sounds, I chose Floyd because of the people. When I came, I had dinner with two of the residents, and I could tell right away that they were actually friends, that they got along really well. They talked a lot about medicine, but it was in such a fun way. And their interaction was really interesting to me. It just really struck me how content everyone seemed, how happy everyone seemed. To see people actually enjoying learning and training really intrigued me. That was my initial impression, and it has been spot on ever since.
Rome is we joke and say it's a medical mecca because you really got just about every specialty there is, at least one, physician. All the specialists are really easygoing, and they're wonderful teachers, and they're willing teachers, which is really important to be able to get things taught to us that we need to know, and to know that they're there for us if we need them any time of day.
It's so important that we have great working relationships with all of the specialists, being able to easily pick up a phone and call or text the cardiologist and the pulmonologist, and running into the GI doctor in Publix and him knowing you is there. There's just really great access to better our experiences as residents and as learners.
I would say that having a residency like this in a community like this is a boon to your education. You're going to be a stronger physician because you got to work directly with any specialty you could imagine and every subspecialty. And you got to take care of people that were very sick in the hospital, in the clinic, and urgent care. And you had a direct connection with those patients and their specialists.
I wanted to be at a program that would prepare me to serve in an underserved area, and Floyd allowed me to get plenty of experience where you have both that rural medicine experience, but you also have all of the same issues that you would see in a big metropolitan city. So I feel more comfortable managing a lot of medical conditions that some family doctors around the country may not have seen in outpatient setting, but you get that experience at Floyd.
Rome is about as good as you could possibly have to blend small town community feel with a huge thriving medical community. We're the only hospital in the community that accepts pediatric patients. We're currently the only hospital that delivers babies. So we see a lot of variety in the medical experience within our hospital, yet we're still just a little community with kind people and local restaurants.
You don't know all the time when you're a medical student that those things are important. What you think is important are stats and how many procedures you do and what is it going to look like on my resume. But you find when you actually start working, what is important is your environment and the people that you work with and how you train and how you're taught and the things that you have access to. I can honestly say, having been here for 2 years, that I get all of that at this program. I get access to great training, I get to do procedures, and then on top of that, I get to do it with great people. And so, my best advice would be to find your people. And if you come to Floyd, chances are we're your people because we're kind of everybody's people.